welcome everybody to the show. We are very, very excited to have on the show Dr. Bob and Jennifer Steeves of the Town Doctor. Well, thank you so much for being with us today. We've given our audience a little snapshot of your bio. Wonder if you wouldn't mind giving us a little glimpse into your personal life.
Sure. We've been married this summer for 20 years, and we have
Congratulations.
Thank you.
Thank you.
We have 7 wonderful children, aging from age 19 down to 4 years old.
Wow.
So busy.
That's fun.
Yeah.
Loud.
Very loud. So 6 boys and 1 girl.
Okay. 6 boys and 1 girl. And I noticed in the picture that you sent me that there's some instruments in the family picture. So it sounds like that's a very much a part of your family.
Yep, very musical family. I play piano. My wife studied music in undergraduate school and was in theater, and we picked up on our kids being interested in music at a young age. And so our eldest is a classical violinist. And
really?
Yeah. Currently,
that's cool.
Just finished his freshman year in college, and is majoring in finance and minoring in music, and helping the school develop their music program. And then each of the kids either sing, play piano, play violin. So yeah, very musical household. Yes.
Really great way to bring them together.
Well, and I was just wondering, so do you have some that aren't as musically inclined? Yeah,
we have my second eldest is very much into athletics.
Okay.
But so was my first child. He played baseball, was very athletic, very talented, and then decided to put down the bat and glove and say, I want to focus on violin. And so, we have some that are really into music, some that really like to do other things other than music, but most of them come back to an instrument, which is pretty neat.
They're just at different stages of learning. The real young, still just picking up the instrument. And I guess it doesn't sound so much like music, but we encourage them to keep picking it up, because that's the way the older ones started as well, way back when.
When do you start them out with music lessons? Was it just kind of when you saw them engaging in music, or how did you figure?
Even now, I mean, our oldest actually instructs our younger ones. Our older ones help teach the younger ones. So we put the investment really in the older ones, hoping that it would turn around and benefit the younger ones. And we found that they've really, I think that they've really become his little project at the same time, because he can get them to, start to play together. And then at the same time, it creates opportunities to, bless others, we come into contact with or have them join in, and it's a good time,
Yeah, it's funny that you should say that. So I have 3 girls, and then we just found out 2 weeks ago we're going to get a little boy.
Oh, congratulations!
Cool. Oh, we are so thrilled! Oh my goodness! So I mean, we're very much opposite, and certainly we don't have the number of children. I hope someday we could come somewhat close.
Yeah,
I think I mentioned last time we talked, the plan is to have 6 and whoops. So we'll be, you got to plan for that whoops. So it's not as
exactly.
So
exciting.
But I was watching our oldest daughter. She was reading with the two girls, and she was teaching them how to read, and I thought, boy, if we can just invest in the older kids and to make sure that they're teaching the kids piano and everything else. And so, well, that's fun. I'm really glad. It sounds like you're extremely active. Oh my goodness,
very busy house.
Busy.
Always taking people to lessons and trying to figure out schedules.
Yep.
Isn't that the balancing act for every mom and dad? I think, no matter the number.
Right. Well, and it just scales as you progress in life. It just scales, and new adventures pop up all the time. Well, do you mind talking to us? I usually don't get into this as quickly, but I'm just really curious as to how you transitioned into where you're at now with the Town Doctor.
Yeah, so, I practiced in a private practice up in upstate New York, and then moved down to Middle Tennessee area, just outside Nashville, and was more on the corporate side, so an employed physician with a hospital system. And really, built a very rigorous practice, got busy, but found when I started needed, more staff, more nursing, more people to answer phones. They weren't willing to support that. So a lot of that work fell on my shoulders to keep the practice, to make sure, patients were safe, taken care of, and follow up. So, that required a lot more time. And I really began to push them, to say, hey, this is, really going to jeopardize, patient safety if we don't have the staff to support what we're building. And so I was let go about a year ago for no cause. It was a no cause termination. Just means that, I got a severance and, thank you very much for your services. But it was a great time, a 90-day window that I was going to be able to be paid to set up something that Jen and I had been wanting to do, but just didn't know when the right time to do it was. And as a family physician, I'm very involved with families and patients. And I really just saw that the doctor-patient relationship was quickly deteriorating in our country and in the traditional system that we practice. I think it's unfair both for the patient and the physician, to have 7 minutes to spend with each other, and you have 4 other people waiting in rooms to see you, to try to deliver high quality care like, I thought I was going to be able to do when I started my journey in medicine. So we just came up with a model called direct primary care, where we put patients back into the forefront of medicine and our relationship, and we cut the insurance companies out of the equation and third party payers.
Okay, so you were explaining about how the quality of care was something that you didn't feel like spending 7 minutes was enough with your patients,
right?
And so you're finding that it's different now. And if so, how, what really has changed now that you have your own practice?
So where I was accustomed to seeing 35 to 45 patients a day, a busy day in our office is between 6 and 8 patients. So we allow 45 minutes for our appointment times. Which just enhances that whole doctor-patient relationship. I really get to know these folks, get to know their family, get to know their work life, and basically anything that's sensitive to life, we can talk about those things. And it really, for me, has been just such a cool thing to see, because some of my older patients from the previous practice came over to join this model. And the things that I learned about those folks, I've been caring for them for 4.5 years, but to have that extra time and to really realize some of their needs and some of the hurts that they were in, and the financial situation or family situations, was just astounding, and it just really, excuse me, reinforced that need that, patients just need our time. They need our time. And if you have that time to give, you can deliver just such better, more cost-effective care than I could previously.
And I don't think anybody would argue with that. I wonder what people, have you had any outsiders ask, are you able to see as many patients, and are you able to cover the cost of running a large organization, a large family practice?
Yeah. And the answer is, drastically. Our overhead has decreased, by 80%,
Really?
from a traditional family practice. I don't have to deal with insurance companies. So, time, spent doing, prior authorizations and denials from insurance, arguing with insurance companies is almost non-existent. So that's just a huge time saver right there. And we don't rely on volume to make a profit. So instead of, me waiting for an insurance company's reimbursement every month to to pay the bills, our membership supports the practice. Our patients are supporting our business. And so it's a neat model. And, we do labs, we do x-rays here and other things that are extremely discounted. And we're being transparent about those prices. And we pass through those savings to our patients. So for instance, if you come in for a physical and we do blood work and we're looking at your kidneys, your liver, blood counts, thyroid, cholesterol, we do that for $20. In my former practice, they would bill someone's insurance company $2,200. And
oh my goodness.
Yeah, if you have a large deductible, guess what? You're stuck with a $2,200 lab fee. And so we have just been working for our patients, being transparent, and it's really made us very successful here in our community.
Fantastic. I want to ask both of you, but first, Jennifer, if you wouldn't mind maybe addressing some of the initial challenges in starting the practice and implementing this model.
Sure. I think one of the biggest challenges, in this type of model, because it's so fresh and so new, is really educating the patients in the difference between a direct primary care model and a traditional model of care, and where they're able to leverage their spending and their healthcare dollars over the year, using this and utilizing this, because we work directly for the patient. And that takes time because the media isn't doing it. We're doing that, individually and in town halls and, with employer groups or, HR departments. And so the time spent doing that and seeing the benefit, of this relationship and working directly for the patient. That's what we say is, what makes you different? We work directly for you. We don't work for the insurance company. And because of that, we're released from the regulations that a traditional model is bound by. And able to, pass through these wholesale savings with labs and imaging. And like he explained there with just that one example, that lab work, they were able to leverage their fees throughout the entire year and have 24/7 access. So we're able to eliminate some of that wasteful spending and really put it back in the patient's pocket again. And we're able to see, at the same time, we're optimizing their health outcomes because we're not bringing every patient in for an exam where the insurance is requiring a patient to come into the office. We're able to utilize and foster the relationship through additional vehicles of communicating. Our patients text directly with our physician and our healthcare team. They can email us directly. If they're on vacation, they'll shoot us a text. Look, I got, this is going on. This rash is going on. What do you think about this? Well, we've kept them out of the ER, that type of thing as well. So they see the benefits in that way too. They're not spent the time sitting in the waiting room where they are.
So I'm just curious, before Bob gets into maybe some of the challenges that he's seen, would you mind just walking us through, Jennifer, kind of how things started? I mean, the first, you have this idea for a new model. You start growing the business. I mean, what were some of the preliminary things that you had to do to develop this model?
Sure. Like you mentioned, we have been talking about a different model of healthcare, for well over 5 years. And direct primary care is not brand new. It's been around in different forms. We've heard of concierge care. One of our biggest focuses is that we want to be able to take care of all demographics. Patients that have 10 care or no insurance, to the executive sitting behind the desk with premium insurance, as well. So we decided, in this direct primary care model that we were able to accommodate and serve all patients, no matter what type of insurance they carried, whether they had good insurance, bad insurance, or no insurance. So working through some of those things over the last couple of years, how can we do this? How can we create partnerships and relationships with labs and imaging, and just walking through that. And, really it came down to just asking them, let's call the lab company. What can you do for us? How can we get better rates? We could do this because we eliminated, the insurance regulations that he was initially bound by, in the traditional model.
Yeah. Okay. Thanks for clarifying. Bob, what would you say have been some of the challenges initially?
So, when you head out on your own, that's a big deal in any business. To step out, my strengths has always been medicine and clinicals and diagnostics, but, to move into a role of CEO was, a little bit overwhelming at first, because that's not, my forte. Is managing a business. I'm a big visionary guy. I can, paint a vision, but the team that, we get to work with really help me with details. This is how we have to get to where you want to go. And I think, collaboratively, we work really well together. So, the other thing is, doing a new model, doing completely a new thing and going completely against the grain of where we are with American medicine, and say, hey, you know what, we're going to stick our head out here and we're going to do this and not look back, and just say, we were going to commit to this. We're doing this for patients. And, I had a mentor once say, if you're taking care of your patient, you'll always be successful. And that just has always stuck with me. If you're looking at, what you can get reimbursed for things, how many procedures you can do on a certain, patient, and you're looking for that bottom line from month to month, you're gonna fail miserably. And I think we see that in American medicine. The system is imploding. And so, for us to do this, a lot of my colleagues said I was absolutely insane.
Oh, really?
You're committing professional suicide by doing
really?
this. Even though every one of them would love to be able to practice the way that we practice. I guarantee it, because I hear it every day from disgruntled physicians, especially those that are in primary care, overworked, underpaid, understaffed, and just miserable. I mean, they really are miserable human beings. But this has been such a game changer for me personally, as a dad, as a husband. I got my time back, and I got it back personally with my patients. And you know what? If that meant a pay cut, that's well worth it to me, because I know that I can put my head down on my pillow every night and I'm at peace with the way that we're doing things, because I know it's what's right. Mm-hmm. I know it's right for our folks.
Wonderful. I love that. And I love that you said that you're able to get time back to really do the things that matter most in life, that really have a multiple effect on the quality of your life.
That's right.
Mm-hmm.
And so what would you say to physicians listening to this that say, I feel that misery. I would like to be in a position where I provide more quality care, mm-hmm. And things aren't so much like an assembly line.
Right. I would tell them that they're not stuck. I believe in the foundations of our country in America, that we have that ability to create and do something different. The machine has told us otherwise. We go from the day to day and we lose that intellectual property. And unfortunately, a lot of physicians' property is bound up by contracts and things like that. But you know what? We need to, as a group of physicians, step out and say, enough's enough. Mm-hmm. We're going to do this different. And I would tell those that maybe are listening to this, give us a call. We've got it. We can walk you through it, like a group did for us. And, we can give you the resources and set you up. And it's really very simple to be able to do this. And so I would just encourage them, life is way too short for you to be unhappy in what your dreams were as a doctor. They're being taken away. And it's time to to step out and say, we need to do it different. I need to do it different, not just for patients, but personally for my family, which are even more important, right? And so, I hope that that's encouraging to folks that are listening.
Thank you for sharing that. What made you decide that it was going to work best to work together in this?
That's a great question.
You asked us 10 years ago. I don't know.
If you had a crystal ball on our wedding altar and it said that you will be working with your wife, in 20 years, I probably would have fell over. It has been such an interesting, awesome thing to be able to go through. My wife immediately the day I was let go, just took the reins and said, we're going to do this. And had encouraged me to walk with the vision that I've had and that I've known in my heart what to do. And so through that whole process, it's just been incredible to see how we actually work very, very well and complement each other in ways that I didn't think were possible. And just to appreciate how much she's learned the industry and the lingo and the terms and, what kind of products are out there that people are going through and dealing with when it comes to insurance. And she has in my opinion, has become an industry leader in this kind of movement in direct primary care. It's just incredible to listen to her talk to patients and do, interviews like this to see where she's come from. And I've always known that she's smart. She's a registered nurse and has worked in wellness and in all areas of medicine. But this is just a knack that she's excelled at, which has been good. And then my nurse, Amy, who's been with me since I was, a resident, who left New York to help me come down here when I first started to practice. I mean, and wow. She gets me how I do things. So on that clinical end, has just been another huge team member. And then I've been fortunate lately to work with my mother-in-law, Jen's mom, and so she's part of our practice. And so it's a sense of family, taking care of families, which has been just a really cool thing for us.
I love that. Bob, I want to acknowledge you for what you've just said about your wife. I loved just listening to you share that about your wife, someone that I know you care so deeply about.
Right.
And a lot of partnerships, they struggle. Marriage partnerships and business partnerships alike.
Right.
Sure.
So I just want to acknowledge you and thank you for being such a great example.
Thank you.
People like myself.
You're welcome.
I love you. Thank you.
Jennifer, is there anything that you would add on why, how you felt this partnership could work when you saw that he had a vision and you determined that that you'd like to take those steps forward?
There really was no question. Like you said, when he stepped away, this was the time, we had 7 mouths to feed, and we said, it's do or die, and this is what we're going to do, And so, it's sometimes you just step out in faith, where you take that next step and just trust that, God was going to show us each next step. And we, like you said, we really do and have been so blessed with a powerhouse here, of skills, through our nurse and, with her bringing her whole family down here from New York. We moved down here initially and then taking my mom on. And it really, we are very fortunate to be able to put those skills together and, complement each other's, strengths and weaknesses through it.
Fantastic. I'm very curious if you'll teach other doctors how to take the steps forward and to understand how to implement this type of a model. Do you have any aspirations for that in the future?
Yeah, we do. This first year in practice has been, kind of getting our bearings and, correcting some of the things maybe that we provided in the beginning that needed to be different, to make more financial sense for things. But, I think our model is pretty solid. We, are always looking at things and looking to change it and make it more efficient and streamlined for folks. But, absolutely, I'm open to doctors in the community or even physicians in residency right now that are in family practice. One of my aspirations would to go and speak to third-year residents getting ready to graduate and say, hey, this is before you go sign your intellectual property away to a hospital for your next 3 years. Let's think about some things that could be different, and stay true to what family medicine's all about. So definitely something that once I can get a partner here and get freed up a little bit with my time, would love to do.
Well, and I just want to say we've had guests on the show that have done that same thing. So that model is a proven model that's working very, very well.
Right.
And I, as we just talked about, pain that so many doctors are likely going through that are listening to this show. I mean, how liberating to know that there's another way, to know that there's something that can give them to give them time back.
Right.
Nobody's gonna be on their deathbed and wish they worked more hours at the office.
Yeah, that's right.
Very curious to know if you wouldn't mind both just taking a minute and to share with us. We'll start with Bob. Maybe one personal habit that's contributed to the success that you had in your life.
Growing up, I just had my father was a blue collar worker. Worked for $2.80 an hour in our local township.
Wow.
And we were very poor family, but the guy would get up at 2 a.m. to go plow snow in upstate New York, and he'd work long hours and long days and sometimes holidays depending on what the weather was during the winter months. And so I really watched that work ethic and drive because I'm sure there were many nights, many days that he would have rather been home with his family or just had a day to himself. But his obligation was to his children and his wife to provide, and that just has always stuck with me. With no matter what job you have in life or what position, give it your all, and even if it's for a time or a season. I have this conversation with my kids right now. Some of them are at working ages and, doing things that they don't necessarily like to be doing. But, when I was going through my training and my undergraduate, I was laying blacktop, working construction and, doing different things that I didn't really like to do either, but I showed up and I gave it my best, because people see that and that served me through my career.
Fantastic. Thank you. And Jennifer, if you wouldn't mind sharing one personal habit that's contributed to the success you've seen in your life.
Yeah, I think maybe, determination. I could become pretty determined. I think even going back to our early years of marriage, we were 19 going on 20 when we first got married, and, being told, no, you're crazy. Yeah. And maybe we were, we probably were. And, hearing, no, don't do that. You'll never make it.
Yeah.
And, and then, going through undergrad, pregnant 3 months later, you're having kids now and you'll never make it. And, and that was just that extra push to, keep going, watch us. And, and stepping out into, in a countercultural way, in a lot of different ways. We did things, that way. We homeschooled our kids, and, hearing that no, and really turning it around, watch us, and in the same thing, now with starting a practice, it's something different. And, you guys are crazy. We'll watch us, we're going to do it. We're going to make it happen. We're going to do the right thing. And, it's not easy. It's a lot of hours. We do a lot of thinking at 3 a.m.
Right.
But we're but we're not ticking boxes for the insurance company at 3 a.m. anymore. We're doing what's best for the patient now, and what we want to do.
Right.
So, we've taken that and have that freedom now, which is a great feeling.
I think that's why a lot of doctors become more entrepreneurial, is because they want freedom. And freedom is having more time with your family. It's being able to do things with your family financially. There are several vehicles within that, entrepreneurial freedom type of a model. And I just like to hear how, and this will be the last question from both of you. We'll start with Bob on how your definition of entrepreneurship has changed since, from conception of, okay, we're going to develop this and move it forward to where it's at today.
Again, it's keeping our patient first, and and that brings its own inherent success, and that's what's made us successful. And so if we can build things, ancillary services that surround our patient, let's get them healthy, let's develop a wellness plan for them, let's start a 12-week program for weight loss, and it's driven towards the health and well-being of the patient. It has that inherent basically ancillary service that brings more value monetarily to your practice. But I always tell folks, I could be doing Botox, and I could be selling some product or cleanser or this or that, and I could be a bazillionaire, really. I mean, I could do that.
Yeah.
But that's not what I studied for. That's not what I went into medicine for. It was about relationship with people, with families. And so I think, when we think about entrepreneurship, we want to continue to develop this model and grow this model. I'm not going to say, okay, I'm done. I've got enough patients.
Right.
Good luck, everybody. No, we want to continue to grow this and bring people in and develop this here in the Nashville area. So, and we did it in a pretty tough blue collar community. I mean, these are hardworking folks. Most of them have insurance coverage and are choosing to be a member here because they see that value, and they're not going to give that value up. Yeah.
And Jennifer, if you wouldn't mind sharing your definition of entrepreneurship and how it's changed from where you're sitting.
Sure. I feel like entrepreneurship really is something that, comes from my heart and is really giving us an opportunity to educate the patients in the way that we best, see fit, in an honest and a transparent way. It allows us to bring integrity to healthcare where we're not seeing it. It also allows us the freedom that when a vendor walks into my office and says, we want you to offer our services here, we can drive a bunch of revenue to your practice. And I can say, well, that's not integral. There's the door, and you can walk right back out. And
Right.
So having that freedom to be able to make decisions and the best decisions for our patients to optimize their health outcomes is really one of the best things and one of my favorite things about being an entrepreneur and creating this model in this innovative way here in the town that we live in.
Fantastic. Well, we are just so grateful that you both have been available to make some time to be on the show today. I think you've been very relatable for a lot of people listening in, not just because a lot of people have been in the position where they want to know what more they could do in scaling their career and enjoying some real advantages of having more quality relationships with patients, having more quality of life. And I imagine your patients relate a lot with you because you are a big family working together to serve the community.
Yeah. Yeah.
So thank you very much. I guess I do have one last question, and that's if you'd have some parting advice for our listeners, and what would it be?
Well, I just think that when you feel something in your spirit or in your soul or whatever faith you're from, that don't ignore that. That's something that's been placed there. That's something that you need to pay attention to. And some people feel that at 2 a.m, write it down. Some people, just walk through life. Some people, have dreams, and then there are some people that will beat their dreams into submission. And so that's kind of a mantra that I followed. Don't just dream it, chase it down, beat it into submission.
I love that. Jennifer, would you add anything to that?
Absolutely. No, I think, what he said, is true for me too. It's okay to be different, step out in faith. Amazing things can happen.
Yeah, absolutely. Well, thank you so much again. We're going to say goodbye for now. If you wouldn't mind just holding on the line, I'll visit with you afterward. And it would be nice to bring you on in the show in the future to see how things have scaled.
Great. Thanks for having us
again so much.
Thank
you. We'll go ahead and end now. Thank you.